Thank you.
Thank you. In healthcare system, there are 6 blocks. The first block and most important is doctors and nurses. But you must make sure that after you review all the blocks in the healthcare system, there is enough money left on the table to look after the nurses and the doctors, and also other health professionals. So we shall be engaging in dialogue with them to know what their requirements and demands are. If they are reasonable, there's no reason why we cannot actually oblige to what they be asking for, subject to availability of funds. But clearly, we know they need to be looked into their requirements, because we really have to avoid nurses and doctors living in this country. You go to any part of the world, you find Kenyan nurses. Botswana, there are a lot of nurses from Kenya. I was told that the best nurses in Australia, they come from here. You go to the US, they got green cards. Yeah. Why are they leaving the country? Because the pay is possibly not adequate. In addition to that, their living conditions, their working conditions. We really have to make sure that they are working in safe and acceptable working conditions, not just the pay, because the conditions do affect also their personal health. So we shall certainly be looking into those matters. And that's why Kenyans have to work very hard to make sure that we get double-digit growth to be able to fund these kind of programs. The first year may be difficult, but if all things go according to plan, clearly we shall be having enough money to pay people in the future. But that will come after dialogue, so that we can understand the key issues.